I'm Jay Moran.
I'm Bridget Jaipal Valenza.
I'm Thomas O'Neill White.
I'm Angela Preston.
And I'm Lorenzo Rodriguez.
This is What's Next, a dedicated hour to have important conversations about the issues facing the marginalized and underrepresented communities of Western New York and Southern Ontario.
We're going to have some real healing. We've got to have space to tell some uncomfortable truth.
What's Next continues our mission to discuss race,
equity, and the common concerns of Buffalo's East Side
and beyond.
The suburban area, everywhere. We must work and teach our children.
Good morning and welcome to What's Next. This is Lorenzo Rodriguez, and on today's show we're going to cover a condition, a situation that still for many, many decades has had a stranglehold on the American population, and that is the topic of tobacco use and nicotine dependency. Today I'm joined by Dr. Andrew Hyland and Herman. Dr. Andrew, you are the director of the New York State Smokers Quitline. It's part of the Roswell Park Comprehensive Cancer Center. And Herman, you are a participant of this program.
Yes.
Gentlemen, thank you so much for joining me today on What's Next.
Absolutely. Thank you.
And as I mentioned, tobacco use, nicotine, just one of the leading causes of death and preventable disease in our country. Smoking-related diseases include lung cancer, chronic obstructive pulmonary disease, COPD, and heart disease. Three things to not take lightly. And the New York State Smokers Quitline is helping to hopefully curb the dependency on nicotine and hopefully get participants to just quit and give up this, for lack of a better phrase, a deadly vice.
Yes.
Andrew, can you give us just a history of the New York State Smokers Quitline, your involvement, how it started, what you all do?
Yeah, well, the Quitline in its current form started in 2000 at Roswell Park. We've provided that service since that time. Actually, there were nuggets of it even earlier. There was a National Cancer Information Service. There was the National Cancer Act in the 70s, and we should educate people about cancer. One of those things was talking about smoking, and Roswell Park had a role in that. Eventually, that morphed into a statewide effort and started off in sort of a satellite office over in one of the buildings at Roswell Park. Probably not too much bigger than this studio, which isn't very big for those.
Giving away our not so spacious digs here.
And what we realized is the demand was insatiable. There were lots of people out there throughout the state that were looking for help. So it was initially telephone services. People would call. A lot of it was referral, just sending them information about local clinics.
Was it physicians that would refer patients or participants, or was it family members?
Yes. So in terms of coming to the Quitline, those early days, it was the press release, word of mouth kinds of things. And then into the later part of the first decade of this century, the state began to run some public education efforts to try to help people quit, encourage people to quit, when they're ready. And that really took off. We saw like tens of thousands of people coming to us. There was one moment when New York City adopted its smoke-free policy where you couldn't smoke in workplaces or restaurants anymore. We were 400,000 phone calls in one week. There was a program that gave away free nicotine patches in New York City, and so we learned a lot from that. We learned that demand was insatiable, and we learned that there was lots of interest in these stop smoking medications, which is something to this day New York State is known as like the go-to resource for how you implement something like that. In total, over those 23 years now, more than 2 million people have called us or texted us for help with their stop smoking effort. Currently, we help about 30,000 people a year, and our services are evolving and adapting with the times, ultimately to try to help people, give them the nudge that they need when they come to us. Most people have already made the decision that it's time to quit. So we just want to provide them with some encouragement, with some evidence-based strategies to help them get through some rough patches along the way, because it's not easy, but it's doable.
Mm-hmm.
Lots of things in life are not easy, but you do them because of the greater good. So right now we have telephonic services. People can call us. We can get you that information here. 1-866-NY-QUITS. It's the phone number. You can go to the website, nysmokefree.com. Lots of information there. We have a text messaging program, Learn to Quit New York, and you check that program out. And I know Herman's got a great story to tell about his experience there. We have chat features as well if you're looking to utilize that. So we try to meet people where they are in the format that they're looking for. We find telephone tends to be a little bit older. We find text messaging a little bit younger, but there's lots of people doing each. And again, we get about 100 people a day that are the phones are ringing, and or the websites are humming along the way. So
those numbers are both impressive that you're helping that great deal of folks, but also alarming that we're still seeing this. I mean, I think it was 1964 that the Surgeon General put out his report that, hey, this is not good for our health.
Yeah.
And since then we've been working, I think, baby steps, little by little, trying to get to a better place when it comes to that back and forth with tobacco companies and how they do their business. You mentioned the text line, Learn to Quit New York. It's a 6-week text messaging program. I think from our initial conversation, it's very popular among the 25 and 44-year-olds, but that's a tool that, Herman, that's what helped you in this process, right?
Correct.
So it not for the youngins, it's for all ages.
Yes.
And Herman, your story, I'd start off by asking, how did you first get introduced to smoking, and when did you know that there was a need to start curbing it?
Okay, I started smoking in the year of 1970 under a stressful situation. Most of the people I was involved with at that time smoked cigarettes. And me, because of not peer pressure, but just wanting to be like everyone else, be cool, I started smoking. I was in Canada at the time. Then when I came back to Buffalo, I still had the urge to smoke. And I was always under the impression that smoking relieves stress, fills in the blanks while you don't have, or if you're involved in something, and you light up a cigarette to continue that continuity.
Gives you a little kick.
Yes.
For me, it's I'm Cuban, so caffeine is the one that I have to monitor. But yeah, it gives you that.
Absolutely. And you reach a dependency or, like you say, an addiction to cigarettes, It tends to fill that void from whatever circumstance. A lot of people do it for various reasons, but when I was first starting smoking, I never looked at the ills of smoking, how hazardous it could be to me, okay? And I've seen people that had COPD, got cancer, and I saw the repercussions of smoking. But however, at that time, I never thought it would happen to me. That was just something that happened, okay? And this periodically, through whatever situation I was in, periodically I would smoke, whether it be a happy hour, whether it be an occasion I'm talking to someone on the phone, whether it be a situation I'm trying to resolve, okay? I always depended on, subconsciously, always depended on that cigarette to make me feel better, okay? And okay, when I got in my 30s, mid 30s, I realized that this wasn't the thing to do because of some of the people I was associating with. They didn't smoke. However, that was short-lived because I went right back to smoking, regardless of what the occasion is. Or sometimes the occasion did dictate to me to take light a cigarette. Then, probably my 40s to 50s, I cut down on my smoking, but I realized that I had an operation not related to smoking, but I went to Roswell Hospital to have a thoracic surgery. But then I was in a room with a guy that was a cigarette smoker, but I don't know if his ailment was caused by smoking, but he had a lot of lesions on his back. And then I was an eye-opener where I kind of related to his situation with smoking. Plus, my doctors, every time I would go to the doctor, they would always ask me, did I smoke? And then they would say, no, you can't do this because you... But they said, well, maybe if you don't smoke that much, it won't bother you, but cut down, try to leave the smoking alone. So this resonated, but I can't remember the gentleman's name, but I remember his condition and how he was suffering. And I just attributed that to smoking. But it didn't penetrate until maybe 20 years later. Now, I realized some after effects of smoking, coughing, things, particles getting caught in my throat that I'm eating. When I perspire or when I take off my clothes, I can smell the smoke in it. I would always, after eating, require a cigarette. And those things, to me, was something that I acquired, this habit I acquired, but I wasn't born with that. So I said, I can't leave this alone. At my age now, it's really, I know smoking is detrimental. And a lot of times I would ask myself when I take a cigarette, when I was smoking, I would say, if something does result from this, like cancer or loss of limb, or anything that bad can happen, I would ask myself, was this worth it? And then the more I would say those things or repeat those things, it kind of quelled my appetite to smoke. And then the people that I'm with now, my church members, my daughter, close friends, neither of them smoke. Most of them have overcome smoking. And that helps me because nothing in life is easy. And I kind of think of this every time I do have an urge to smoke, it's going to be hard, but you've overcame everything else. You can overcome the smoking. And to be perfectly honest with you, I haven't smoked a cigarette probably in 3 months, but I still have that subconscious subliminal message, oh, you need a cigarette. But then I know that it's no good for me. I know that people have suffered as a result of constantly smoking. And I know that with willpower, strength, resources, like I'm getting from New York Quitline, my church members, my prayer, my daughter, my family, I can overcome this, okay? I never want to get to a point where I'm relaxed and feel like I never will smoke again, but I know deep down inside I will never smoke again because I will never let any problem drive me back to smoking. Because whatever problem I have, smoking would be just a temporary psychological fix. But the problem of smoking cancer can't be reversed. So that's where I am today. But I can tell you something about, like the survey I took, the New York State Quitline, they always gave me encouragement not to smoke, gave me tools to use to help me in times of maybe weakness, or use these tools so you won't enter that time of weakness. And that's been a tremendous help. And all the things that I've learned from smoking Quitline, I'm hearing from people that have overcome the smoking habit. I've heard a lot of these things in the past, but I didn't pay attention to. But I think one of the biggest things, plus the ads on TV, where these people are deformed, had cancer in certain parts of their body, or they had the ill effects of cancer. Those things, those people I've always seen prior to this time, I never really paid attention to it. Oh, that's just an ad. But now, thank God, for some reason, it's penetrating my thought process. This could be you, not the process, the thoughts I had before. Oh, it couldn't be me. But now I say it could be me, and why not quit?
It's an amazing story, Herman, and I'm thankful you shared it with us. What were some of those tools that really hammered the point home from you mentioned the text line? What was it? There's that moment that because you don't think about it when you're in it.
Sure.
But then there's that you mentioned the patient that you were next to at Roswell. You saw the immediate effects, and then eventually just something a light bulb went on.
Yes.
What were some of those tools that caused that to really materialize?
It was a culmination of things. Plus, it over a time period. It seemed like I got it, but I couldn't connect all the things that affected me later on positively. But okay, one of the tools, the breathing technique, the meditation, the talking with other people that overcame smoking, the having the courage to tell people that you were weak at particular times. If you do, I don't say relapse or go back to smoking, don't beat yourself up. Don't feel like, oh, well, I can't stop, and just give up and then go back to the same old bad habits. And just hope. If you really want to do something, like one of the things in my survey, when I talked to an individual, they said, if you really want to succeed in life, you have to make an effort to do it on your own. Don't depend on someone else to do it for you. Depend on people to help you, but it's ultimately up to you, because there's no excuse. You can't blame anything on anybody else. But once you deal with it yourself, it's a problem, and you know the ill effects, the negativity of what you're involved in. Once you know those facts, then that's when you have to make up your mind to become determined to accomplish what you set out to accomplish.
It's like I said off the top of the show, it's a prevalent issue that, we've been battling this for decades in this country, and I think each of us here have some immediate connection. I personally, I was amazed that in our newsroom just how many of us, somewhat 30s, 40s in age, at one point or another had that social urge to smoke. You just mentioned that was almost the start of it socially.
Yes.
And then for me personally, also at one point a social smoker. Didn't get that. It didn't evolve into anything further. But my father, in his late 30s, was a 2.5 packs a day smoker, and got hit in the chest while he was working in a manufacturing plant in South Florida. Shortness of breath, went to the hospital. Doctor told him and my mother, you got emphysema. And it was that moment that he quit cold turkey, thankfully, for all our sakes. But some folks don't get to that realization until it's unfortunately too late. I'm fortunate. I'm thankful for in your sake that it didn't get to any extreme case like that. But for many others, it's not that case. You mentioned the commercials, the PSAs. I mean, I was a participant of the DARE program. That was a huge program. I mean, that was also initiative towards drugs and other addictive substances. But the same thing. It was Truth, SWAT, all these initiatives, and yet it's such a factor still in today's world, which is super unfortunate. It's great that Roswell Park is doing this initiative because I feel like we have other stories such as Herman, success stories that come out of this program. You mentioned 30,000 a year.
Yeah, well, I mean, Herman, thanks for sharing your story. I mean, it's just an amazing story. And for me, I'm getting tingly because it's everything we could hope for in an outcome. And there's 100 stories like yours every day, and that's just in New York State. And then there's 50 states, and then you see globally where this is going to, where the companies, while cigarette smoking is going in the downward direction, in the right direction for health, here is still a massive global scale. So there's lots of work to do, and it's all hands on deck really to try to work through the public education and try to tell people, because some people don't realize, or maybe in your story, Herman, it was you sort of realized it but you didn't, though. It took time for you to come to it. And I think a lot of people, when they make the decision to quit, it is that process, like, oh, I could quit any time, or I'll quit I'll quit when I'm 30, or I'll quit when I have kids, or I'll quit whenever, and you just have to kind of come to it. But from a health standpoint, there's a media campaign. It's called "Every Cigarette is Doing You Damage," and that is the case for each one. So quitting now gives you the most benefit, but quitting at any time, when you're ready. And most people want to quit. 90% of people who use cigarettes regret having started. And so it's just a matter of trying to work to get that to come out, and then make those efforts. I loved how you putting yourself out there and say, I'm ready to quit, and it use the term courage, because it does to say, hey, I have a problem, and I could use everyone around me to give me a little bit of a boost. It takes courage to do that. That's an important part for a lot of people.
In just a second, I'd like to talk about some of the tactics that the targeted marketing that's employed when it comes to marginalized communities and people of color with nicotine products. But we'll have that conversation when we come back from this break on What's Next.
We here at Buffalo Toronto Public Media love culture, art, and our community. So we had to jump in when offered the chance to be part of the inaugural FIG Fashion event. This evening of Fearless Fashion on September 30th at Seneca One will empower local designers and creators and provide an annual platform for the community to engage with Buffalo's burgeoning fashion industry. Visit figbuffalo.com for more information about the event and the designers. And keep listening to WBFO for opportunities to get to know them better.
You're listening to What's Next, our place to discuss the important issues of our communities of Western New York and Southern Ontario. We want to hear from you. Click on the Talk to Us option in the WBFO app, and we will work to get your questions or comments on the air. Do you have a story or concern that we should be addressing? Email us using whatsnext@wbfo.org. Together, we'll have the conversations that are needed. This is WBFO, your NPR station.
We're back on What's Next. I'm Lorenzo Rodriguez, and I'm speaking with Herman, one of the participants and successful participants in the New York State Smokers Quitline. I'm also speaking with Dr. Andrew Hyland. He's the director of said Quitline. but also the chair of the Department of Health Behavior. He has more than 25 years of experience doing tobacco control research. You've been widely recognized for this specific expertise. You had advisory roles with the Food and Drug Administration, the CDC, the National Cancer Institute, and you were even a deputy editor for the scientific journal Tobacco Control, the leading resource for tobacco control scientists. Dr. Hyland, you deal with participants such as Herman, and you also see younger individuals. I think as now what I'm seeing is the big push for vaping and flavors being put into nicotine. Is it flavoring? Is it the additives, which in themselves are just incredibly toxic and lethal? That's really where, because nicotine has its detrimental effects, but it's everything else that comes with it that these companies are putting into it.
Yes, absolutely. So there's a couple of points here with regard to cigarettes and combusted products. It really is the toxins come from the burning process. So that's like, the dirt, you see the smoke, that's dirt basically that's coming from the combustion process. So the nicotine is what keeps you going back to that dirty well. And so nicotine itself probably isn't harmful in of itself, but again, to the extent that it keeps you dependent and going back to those cigarettes. So the other components, if they're additives or flavors, any of that, that's just kind of marginal around the edges, I think, in terms of actual health risks. With cigarettes, the flavored product that is menthol cigarettes. And Herman, I think that's
Sure.
You had used menthol cigarettes
Yes.
throughout. And, that we see that through the industry marketing where they use it as a tool to make things seem clean and fresh. And I know in many African American communities that
yes,
they sort of use that. Exactly. So the cool. That's like not an accident. How that's done. So there's that component that these you can have harm not just by something itself being inherently harmful, but if it's used as a marketing tool to get people hooked. We also see people who use menthol have a harder time quitting. So there's just, there's tailwinds and headwinds on this. So in terms of the flavors, combusted products, cigarettes, when you burn it, that's where the harm is, and the flavors kind of sweeten the poison to a certain degree. With vaping products, it's a different. There's similarities, but it is somewhat different. Vaping, you're not combusting, so you're not getting as many toxins. But they're not toxin free. We do see we help people who are vaping if they're looking to get off of vaping. You can get hooked on vaping just like you can get hooked on cigarettes, and we see, especially in the last 3 or 4 years, a lot more people who try vaping are progressing on to daily use. The products themselves are changing over time. The Quitline does offer the same services that are tailored to the product. So if you're using other products than cigarettes, the Quitline is a resource to go to if you're looking to try to free yourself of that dependence.
And I'm glad you brought up menthol, because I want to get into the disparities between the racial disparities between white smokers and minority or primarily black smokers. Herman, I saw you nodding your head. You're a person of color. Was menthol your go-to kind of cigarette?
Absolutely. I prefer the menthol as opposed to the regular cigarettes. There was a saying that back in the mid-70s, they would say Cools or menthol cigarettes crystallizes your lungs. Now, I don't know how truthful that was. However, it didn't come over well, but still, it had no bearing on the choice of cigarette you wanted. I can't. The reason for me smoking because I enjoyed it. Another reason, it was cool.
That's the other one. Like we've been programmed since days of John Wayne and and I mean, I worried about when Mad Men was a big thing because that made I mean that was a cool show, but you would see them and you would say what were we doing back then in that era?
Absolutely.
And we just been that's been kind of slow, like subvertly sprinkled into our pop culture in one way or another, and you wonder how much of an effect that has had on folks like yourself, on myself, because I dabbled, and you wonder just how much the tobacco industries have really, they know what they're doing.
Absolutely. And then one of the things when I was encouraged to stop smoking, and you mentioned vaping, because they sold the idea or just the information I got, this was better than smoking. This is an alternative to smoking in a healthier way. But come to find out, as you're saying, it's just as detrimental to your body as smoking. I don't know how the information gets out, like you say, from this tobacco company, the vaping companies, but I was really surprised that there's legislation being passed where and you're talking about upcoming legislation about the menthol cigarette. One thing that concerns me is our legislator and the lobbyists.
Yep.
You know, the lobbyists, they'll pay for votes or pay for non-votes. And I think this country is taking in the right direction, but there's a lot more has to be done. Thank you, Dr. Hyland, for your good efforts, and Tony. You know, I really appreciate it, and all you guys that from the people that I don't know that are involved from Roswell, I give them credit for continuously putting out the word, showing that smoking is detrimental to your body. And then we have to grasp that and look at it. And when you're saying one more thing, but when you're saying that when people get this information, and when I got the information, you know, how harmful smoking is to people, I said, oh, it never happened to me. And I never would have even paid attention to that until it comes close to me, someone that I know that receives the offshoot of bad things, the result from smoking. Then it only penetrates my psyche. But that's the thing I would like for people to realize when you're telling them the harmful effects of smoking, that somehow they can grasp that and never just push it behind them. Oh, I want another cigarette, instead of looking at the harmful effects of smoking.
You're listening to What's Next. I'm here with Dr. Andrew Hyland and Herman, a director of the New York State Smokers Quitline and a participant in the program. And I'm sorry to bring in race. I mean, we like to have those uncomfortable conversations. And some of our critics, whoever they may be, or might be doing a straw man here, but I like to play devil's advocate. And I can imagine, oh, you guys make everything about race. But the numbers, look no further than the numbers. There's 73% of black individuals who smoke, want to quit smoking. And then primarily the numbers of deaths.
There's 45,000 deaths of black Americans every year
because of heart disease, cancer, and strokes. All byproducts of tobacco use. And when you look at how it's targeted, how companies disproportionately target minority communities, their advertising, their presence in billboards and advertising. Thankfully, we're past that. We've outlawed that, but it used to be where you get special pricing in certain communities. You'd advertise in black publications. HBCUs and other community events were also funded by tobacco. So it's targeted marketing, plain and simple. And then when you add the issues of systemic racism and health inequity, health system inequity, it's why you see, I think, a lot of these disproportionate numbers. So once again, I'm sorry to bring race into it, but it's clearly something that the companies know what they're doing in reaching out, in making menthol and menthol flavored cigarettes a pushing point to communities. I wanted to mention we're a long ways away from the 60s, the aforementioned 60s, smoking in restaurants, theaters, practically everywhere. That's gone. There's big changes in laws. Dr. Hyland, you mentioned that there's an FDA lawsuit, correct? Currently, that's hopefully it's statewide and countywide and certain specific that menthol sales are being restricted.
Yeah. See, a lot to unpack in there. I think certainly to consider the role of the industry. They're trying to maximize profits.
Mm-hmm.
So they're looking at ways that they can do that, and you named a number of ways that are there, and I think that's just really the bottom line. They're looking to maximize profits. Menthol cigarettes are sold in lots of countries. It's only in the U.S. where one population segment has such a disproportionate use that 80% of people, African Americans who smoke, use menthol cigarettes. It's like off the charts, and I think you're onto something that kind of marketing, targeted pricing strategies historically, there's industry documents from their files that show their marketing plans, how to reach African American tobacco users. So
I want to make sure, by the way, that I source my numbers. They're from the American Lung Association, so it's not just any old rinky-dink organization coming up with these numbers. It's a tried and tested organization that's been around for a while, trying to combat this very thing.
Mm-hmm.
And as you mentioned, Herman, like you saw it around your population, your friends, and it's stopping that where it's really prevalent that I think we need to focus on. Is there anything that we could do now that or rather, let me rephrase that. Is there anything that you'd like to see be done to hopefully curb it even further? I'll start with you, Andrew.
Okay. Well, sure. And this is where, there's a couple of points. So it's not one approach and that's the only way. Certainly look at the industry and trying to, there's a flavored product that kills half of its users prematurely, so there's no other consumer product like that. And you think of it in those terms, it's outrageous that we let that happen. But there's also, there's sort of bottom up, like the individual to say, okay, I'm going to, regardless of what else is going on. And that's what I heard from some of your words, Herman, that, I'm going to do this. And it doesn't matter what other people think, or because only I can take responsibility for my, so I think those two approaches work kind of synergistically together. At the sort of policy level, there are some things that are happening in New York State. Last year, there was a bill that would ban menthol cigarettes. There are 2 other states that have adopted a menthol cigarette ban already. Several countries, the European Union, Canada, they've all banned menthol cigarettes. Terrible things didn't happen other than more people quit smoking. We project that a U.S. menthol cigarette ban would prevent 633,000 premature deaths and almost 250,000 fewer premature deaths in African Americans. So
currently here in the state, where do we stand?
Yeah, so New York State is about 5% or so of the national population. So you could scale those numbers down. So it would be many thousands of lives saved with that kind of policy, all through mostly through people quitting more quickly, and also with fewer kids starting, because we know the menthol flavor is an important factor. Kids who start with a menthol product are more likely to continue to use the tobacco products when we track them. So that's what's happening at New York, at the New York State level. There's also a federal level, the Center for Tobacco Products, which is part of the FDA. They have a draft rule that will ban menthol cigarettes and also ban all flavored cigars, which is similar. Right now, there's no rules. You get cherry flavor, vanilla flavor. There's no rules at all on there. So those rules are expected to be finalized pretty soon, and then we'll see. So it's a 2-year process. There's public comment. The rules are revised, but they have a public health mandate. So we'll see how that unfolds. I would expect when those rules get finalized, the industry will litigate, and then it'll be up to the courts to decide. And that's probably going to take a while, which is why it's important if New York State wants to take on this issue, wants to try to reduce the health disparities that caused by cigarette smoking, then that's the opportunity for them to revisit that issue in the next session.
Herman, let me backtrack a bit. It's a white, black, brown, everybody problem. But we were having a conversation right before we started speaking. I want to reiterate that for now for the audience. You see these numbers, but what is it that needs to be done in order to hopefully combat this?
Well, your information, your statistics, they show that they are true, that the black community is targeted. But in the information and talking to everyone, and especially blacks, they have to realize that whatever they use cigarettes for, to fill a void, to calm their nerves, to relieve some stress or tension. But the problem is a lot deeper. Religion, education, jobs, self-esteem. All these are tools that we must be cognizant of to help us overcome or any situation. Life is life. But we don't want to make ourselves victims, or we don't want to use an excuse for our failures. But I would like the black community to believe in themselves. Take the facts that are given them and say, "Oh, wow, you're targeting me. I'm not going to fall victim to this, regardless of what satisfaction I get out of this." Think of your kids. You don't want your kids to smoke. You don't want your kids to do anything detrimental. And then just disseminate this information amongst yourselves and feel like you used and abused. But at the final end, you're letting yourself be misused. I did it to myself, but the light came on. For whatever reason, I chose for the light to come on, for me to realize that the black community has to take a stand and then fight against being unfavorably targeted and just don't become a victim.
Very poignant, very wonderfully stated, Herman. Thank you so much. Gentlemen, I can't thank you enough for the work you're doing, Herman, for sharing your story. And I think it's important because there are folks in similar situations, worse situations, that need to just be reminded. I think that's where it comes down to. Some folks don't have that support system around them. Thankfully, there are programs and initiatives like the New York State Smokers Quitline that you found and others are finding. And I just want to give some more time to properly give you all, first off, kudos, but also the opportunity to just remind folks, how can they get involved? Where can they go? How can they seek out help?
Oh, yeah. Well, thanks so much, Lorenzo. Yeah. So today, making the decision for today to be your first smoke-free day, for the rest of your life, best decision you can make out there. So if people are out there looking for help, or maybe a friend or family member, the New York State Smokers Quitline, the easiest thing is to Google it. Google New York.
I've heard of that.
New York,
the Google machine.
New York State Smokers Quitline.
Herman told me
New
about
York
it.
Quitline, and phone number 1-866-NY-QUITS. You can text us to text Quit Now to 333-888. You can go to the website nysmokefree.com. Lots of options there. Simplest is to Google it. On the website, there's materials. So if you're just exploring, you're thinking about it, but you're not sure, great spot. See lots of information. Our text program, Quit Now to 333-888, it's 6 weeks, skill building. Herman talked about some of the skills. You learn a lot of it is thinking about the future, you know, and to help prepare you for those tough spots. There's no required interaction with humans, especially post-COVID, but you can always just basically click a button and you can get connected to one of our live tobacco treatment specialists there. And then telephone, again, like right now, people could pick up the phone, and most hours we've got people working and waiting to help people. It's what they do.
And Andrew, I believe that you're evolving the Smokers Quitline into and branching out into new initiatives and new projects. One of them being Community Connect. Can you elaborate a little bit of what that is?
Yeah, sure. Community Connect. There's actually two programs that that are related to that. One, Community Connect. It's working with community-based organizations to try to have their awareness about the Quitline and its services raised. We work with healthcare providers all over the state. Pretty much every healthcare provider we've had contact with throughout the state, and many of them provide education, awareness. Some refer their patients that use tobacco to us. So we have those relationships, and that makes sense to do. But there's lots of other community-based organizations that are reaching real people, often in circumstances that where they could use a little boost, whether it's through homeless shelters or other providers of different kinds of services. So we're starting a program where we're reaching out to community-based organizations.
That basically can extend out into the
and see if we can work and provide them with information, and then ideally, if they're working with some of their clients who might be identified as using tobacco, to basically literally in that setting, in those community-based organizations, to have them access our services, whether it's through the website or have them call like right on the spot. So it's a way to reach out, expand, and also to reach the communities and the people that maybe need the most help. The other component to this is working with training people to be tobacco treatment specialists. So all of the people that we have working at the Quitline that help people like Herman go through a week-long nationally certified tobacco treatment specialist training program, which we're one of just a few accredited sites to deliver those trainings. So Roswell Park is contributing in-kind resources for scholarships for people to attend those trainings, and we're prioritizing people that serve communities that have been traditionally underserved or bear a disproportionate burden from smoking. So whether it's African American communities or LGBTQ plus communities. So again, providers that are working in those areas that want to gain those skills to really deal with the nicotine dependence and some of the nuances there, a week-long training course. We're just in the forming stages of this, so more information will be coming out when those trainings will be offered, and we'd be happy to come back on the show and talk more about that and how people can get engaged in
you're
those
always
programs.
welcome on this program. It's great. You're combating targeted marketing with more targeted marketing.
With education. We're trying to
yes.
trying to have that be the sunlight.
Excellent. You've all covered all bases. Tony Astron in particular. He was mentioned earlier, and I didn't bring him into the conversation. He's just hanging out here in the shadows, but he's the gentleman that brought this great program to my attention, and I'm grateful that we are given the opportunity to hopefully let others know that it exists. Everything from nicotine replacement medication, therapy medication, patches, gum, lozenges. You got the chat, you've got the text, and you forgot one word that I think is most important. It's free.
Yeah,
free.
The F word. Everyone loves something free, and this, it's great that this vital tool and assistance is just that, accessible and free. Gentlemen, thank you so very much again for making the time, sharing what you're doing, and sharing your stories. I appreciate it.
Thank you, Lorenzo.
You're listening to What's Next here on WBFO and WBFO HD1 Buffalo, WOLN Olean, and WUBJ Jamestown, your NPR station.